Thank you very much, Michael, and I want to first thank you for bringing us all together this evening. I don't have a whole lot of answers. I have a lot of questions, but I think it's very important that we've had an opportunity to get together as a community and talk about the future of healthcare, and in particular our concern about the potential for closure at San Leandro Hospital, which I don't know about the rest of you, but I think that's a very scary proposition. I've represented this area for a very long time, and every time the hospital operators have changed at San Leandro Hospital, they have always sought a new operator to come in behind them. And I guess that's my very first question. Why can't we find an alternative? Why can't we find another operator if Sutter is no longer willing to operate the hospital? It's been done time after time, and I think Supervisor John Joya's presentation was very important, because maybe it's not the way we would be able to do it here in Alameda County, but it gives us the thought and the hope that maybe there is a way to put together assistance from the state and any other sources, who knows. But at least maybe there's some way to have a plan to save our hospital. And I'm also here because, I'm willing to do whatever it takes at the state level to help with keeping the hospital open. I don't know about the rest of you, but I live here in San Leandro, and I've been to that emergency room several times. And it would be a very difficult thing for me as the mother of a teenager to not know that there's an emergency room nearby and that I needed it. I think that we should definitely explore all of the options, and I'd like to hear, I'm sure there may be some other suggestions here this evening. I'm very concerned that we would also not only lose the emergency room here, but what impact does that have on the other hospitals in the district? I'm very interested in hearing from Nancy Farber and Mike Mahoney, who operate 2 independent district hospitals here in our area. How will that impact them? How will that impact Sutter and Castro Valley, that is going to be rebuilt with fewer beds? I don't know about the rest of you, but I think it's sort of a nightmare. I think the other things that concern me are, as Councilmember Gregory mentioned, San Leandro Hospital is one of the biggest employers in the area. Where will all the support staff and the nurses go to work? Will they be displaced? And one thing of particular concern to me, we have all types of health care here in Alameda County, independent districts, Kaiser, and those sorts of things. But we have independent doctors who have privileges at San Leandro Hospital. Where will they go? If they no longer have privileges at San Leandro Hospital, will they move their offices to another part of the county? Will we lose them altogether? Where will people go for their hospital visits? My mother hates this when I talk about her as a senior, but she's a senior. She lives here in San Leandro. And she can drive over to the hospital, and we feel she's safe to get to San Leandro Hospital, but if she has to get on the road and go a further distance, what will happen? So those are just some of the concerns I have. I do know that obviously there will be an impact. We've heard a lot about whether beds are used or not used in Alameda County. I know that at least one hospital is increasing the number of beds they have. What will the impact be of losing, how many beds do we have at San Leandro Hospital? I have it here in my notes. We would lose 122 beds. And Sutter and Castro Valley is already decreasing their number of beds from 170 to 134. It's not as if the population in California is decreasing. It's not as if the need is decreasing. So, I know this is tough times, believe me. I've been in Sacramento every day this week, driving back and forth to the district, and they are tough times, but I don't know about the rest of you, but I'm willing to fight to see that we can keep this hospital open. I'm not ready to It won't be easy. It will be very difficult, but I think we need to call on Sutter and ask if they can either continue to operate, or at the very least, give us the time to put together a plan so that we can bring someone else in. Or we can put together something along the lines of what John Joy talked about, or whatever it may be. But I just believe that we shouldn't give up on this hospital, and we should do whatever we can. So I'm glad to see you all here this evening, and I'll shut up now because the most important thing to me this evening is to have a chance to hear what everybody else has to say. So thank you all for coming out tonight.